Good afternoon. Welcome, everyone. Really happy to see you all out today. This is a grand opportunity for us. We're coming to you primarily from all of us are from the College of Health Sciences and/or the College of Education. So it's an opportunity for us to get together with you to highlight our goal and some of our goals around interprofessional education, but also some of our progress that we've made toward achieving those goals and making interprofessional education a standard for the educational norm for health profession students and others. And so today we'll talk about that a little bit, the context of interprofessional education, where it's come from, where it's going, and how it has grounded us in a firm foundation of collaboration and advancing a shared vision for quality education for students with the ultimate purpose of quality, safe, and good experience, patient health care, and patient outcomes. So I am Kimberly Adams Tufts. I'm the Assistant Dean for Interprofessional Education, and we'll talk about that. What is IPE? For the College of Health Sciences. I'd like to introduce my colleagues today. First, we have, immediately to my left, we have Dr. Capria O'Q. She is an assistant professor in the College of Education. Immediately to her left, we have Professor Denise Claiborne. She's a senior lecturer and the director of the Dental Hygiene Clinic in the College of Health Sciences. Next, we have Dr. Johanna, or we call her Hannah Hoke. She's an assistant professor in the College of Health Sciences, and her specialty discipline is athletic training, and so she is in the School of Physical Therapy and Athletic Training. And I'll step back a little bit and tell you that Professor Claiborne is in the School of Dental Hygiene. Immediately to Hannah's left, we have Dr. Rebecca Poston, and Rebecca is an assistant professor in the School of Nursing in the College of Health Sciences here on campus at Old Dominion University. So now that we've all introduced ourselves, and you can see we're quite a diverse group, discipline-wise, position in the university, the schools we are affiliated with. So we're actually perfect. This group that we have here represented before you is a grand exemplar of what you can do with what I call interprofessionality, or what has been coined interprofessionality, for purposes of advancing interprofessional education. So what is interprofessional education? Well, the World Health Organization put forth a basic definition that most folks glean to in 2010, and here we are in 2016. And we believe that interprofessional education is when students from two or more disciplines learn about, with, and from each other for purposes of enabling effective collaboration. And why do we want to effectively collaborate? Why do we want to get together and work toward common goals? Because our primary focus and purpose is to transform the healthcare system in the United States. And in that transformation, whether we come from dental hygiene, whether we come from the College of Education — I see Christine in the audience, and she's particularly interested in complementary health. I see Allison, and particularly interested in education. Whatever background we come from, there's Liz Smith, interdisciplinary education. All of us will have an opportunity to be a patient, and I hesitate to use that word, patient or client in a healthcare setting or system in our lifetimes, or we'll know someone. All of us live in communities, whether it's in Virginia Beach, whether it's in Suffolk, whether it's in Williamsburg and Norfolk. We all live in a community. So what do we want? We don't want Flint. We want clean water. So we want good population-based outcomes, health outcomes. We can't be healthy without clean water. So interprofessional education is our opportunity to educate students in such a way together, not talk to students about each other. Oh, let me tell you, my training, if you don't know, background is in nursing. I'm a women's healthcare nurse practitioner by education. So I might go out and say, well, you know, in class, I'm teaching women's health, and I'll say, it's really important that women have good oral health, that they learn basic hygiene, oral hygiene practices, that we ask them about their oral hygiene when we're discussing other things, childbearing, or we're discussing their general cardiac health. Well, that's wonderful. We want to do that. However, it's much more powerful and appropriate if I want those students to think about and know how to engage and interact and collaborate with the dental hygienist or a dentist or someone in the field or someone in public health. And so if we don't educate them that way, what we've learned in the last like 35, 40 years, Institute of Medicine 1972, Pew Commission 1998, coming to 2002, if we don't engage in interprofessional education, none of these lofty goals and very valuable and important goals will ever happen. So, basic definition of IPE, what's involved? We've defined interprofessional education. We've talked a little bit about why it's important. And the graphic or the diagram there shows you the key components to interprofessional education. So of course we have interprofessional education as core. We have students engaged, that students must be engaged and participate. Faculty must be engaged and participate, and community. And community can mean anything it means for you. It can be a patient, it can be a client, it can be the structure of the community, something civil engineering would get involved in. How many walking pathways? What's our safety in our community? Is it safe for people to walk? Do we have sidewalks only on one side of the street? So community is very important in interprofessional education. So community is how it needs to be defined at the time and how it's relevant for the specific purpose. So we have some domains or competencies. This is competency-based education. So there are 4 competencies. You have students, faculty, community, working together to achieve 4 competencies. The first is roles and responsibilities. And this is knowing something about your own discipline and others for a purpose of working together and valuing it and addressing identified health needs and desires. The second is ethics and values. Working together in a spirit of mutual respect and valuing the contribution of self and others in the mix. Then we have the third competency or domain, and that's effective communication. Interprofessional communication, speaking together with other disciplines, with patients, with family, with community, and setting mutual goals, working through mutual objectives. And the communication is for the purpose of advancing and enhancing health. Then teams and teamwork. Having the ability to apply relationship building and techniques and strategies for purposes of forming teams and then working together as teams for that core purpose, once again, to advance health and to move toward better health outcomes. Stepping back a little bit, transforming the health system in order to do that. So we have to work as teams and teamwork. Or as Tina Brashear said last week at UVA, she was speaking about interprofessional education. We can be on the same team, but are we really doing teamwork? Well, we're not if we're not true allies. And so what I'd like to do now is show you one more slide. and talk about interprofessionality, and that's what we're highlighting today. Colleagues from different disciplines working together for the purpose of advancing education and scholarship. And those strikeouts are purposeful because their definition relates to IPE, interprofessional education, in a healthcare setting or in the context of healthcare. We're highlighting today why we have to engage in interprofessionality for the purposes of collegial collaboration to advance education. So, interprofessionality revisited. The purpose by which faculty reflect on and develop ways of collaborating that provide an integrated and cohesive answer to the needs of the student. It involves continuous interaction and knowledge sharing between faculty, organized to solve or explore a variety of education and scholarship issues while seeking to optimize the students, the college, the university's participation. Interprofessionality requires a paradigm shift since interprofessional practice or education has unique characteristics in terms of our values, how we operate, our codes of conduct, and our ways of working together. And so now, I think we move on to talk with our colleagues here. And we have some structured questions to highlight for you what happens in the scheme of interprofessional education when colleagues from different disciplines work together, collaborate together toward education and scholarship. So, please describe how engaging in IPE has enhanced your teaching.
I guess I'll go ahead and take that one first. Essentially, IPE has enhanced how and what I teach. And when I say how and what, how I teach has become more flexible. I have more opportunities to engage with colleagues across the campus. I've discovered more community resources through IPE, and it also expands the reach of education. And so that leads into what I teach and how it's expanded. I'm a counselor educator by training, and so I teach school counseling students, mental health counseling students, and some college counseling students. And so essentially when I teach, I'm teaching about counseling skills, how to be empathetic, how to be nurturing, how to work with clients. And ever since IPE, I'm teaching about geriatric populations, medically fragile children, and how to work with these families. It's just changed the scope of what I'm teaching now. And so I don't have to do it by myself, and that's the benefit of IPE as well. I have a colleague, actually, I was just talking with her, Dr. Christy Fowler. She's in nursing, and she's a geriatric nurse practitioner, a word that I've never heard before being involved with IPE, right? So even that has expanded my knowledge base. And I said, we don't have a class in aging at all in counseling, and that's the largest group. That's the largest growing population in the United States, and we don't have a class on geriatrics. And so I said, would you feel comfortable doing a PowerPoint for me? She said, of course. She sent me 10 articles, a scripted PowerPoint that gave information about geriatrics, about mixing medications. And I had a student come up to me and said, that PowerPoint that you did about geriatrics. I said, what PowerPoint? I said, oh, no. Dr. Christy Fowler did a PowerPoint about geriatrics. What about it? Was there anything confusing? She said, that was the most helpful thing I've heard because I'm working in an assisted living home. And I needed that information. I needed to know about medications. I needed to know about how to engage these families. And I thought, well, aren't I doing a good job? But aren't I helping you enough? And she, it was, I thought that in my head, but then I thought, this is what IP is about. It's about reaching out to colleagues across campus and them being available and me knowing about them. And then me using the skills that people have across campus. There's no need for me to do it all by myself. If you ask me about medically fragile children, I have a colleague, Dr. Tina Haney, who knows this. I can just call her and say, hey, can you help me with this information?
So you're speaking about your colleagues and providing you with resources. Can you tell us about how you work together with your colleagues in the same classroom or on projects for the purpose of advancing interprofessional education and a quality education for students?
Certainly. And so with some of my colleagues, we've been working since 2012 on some HRSA grants, which are originally nursing grants. And so we work together, we collaborate on different opportunities in terms of presenting and in terms of developing curriculum that people can take together. And I say it like very simply, just so people can understand. IP is not this big elaborate thing that you have to do. It's essentially getting people in the room together and educating them together. And it works, and it's very simple. And the way we broke down some of those barriers, because the first year we had nursing, dental hygiene, physical therapy, and counselors. Everyone had different schedules. Everyone had different grading criteria. Nursing, I think, had the highest grading criteria. My students were scared to death, like, a 90 is not an A. And I'm like, well, for nursing it's not, but for us it is. And so we had to negotiate all of those different issues behind the scenes. And then when we got to students, we had the course online, and it just broke down the time barriers. You know, we have classes in this block, and we have classes in that block. So how do we do it? And instead of just throwing it all away, we decided that technology was the best way to bring us all together. But we can also do it in the classrooms, too, and it does work.
Excellent. Is there anyone else on the panel who would like to respond to the question, how has interprofessional education enhanced your teaching?
Just going off of the last example, I would say last spring, also in the College of Health Sciences, myself, School of Dental Hygiene, as well as 3 other colleagues in environmental health, community environmental health, public health, and nursing. And one of the colleagues is in the audience here now. We received a service learning grant through the university. And the service learning grant allowed for the 4 disciplines, nursing, dental hygiene, public health, environmental health, to come together and with our students as well and create a project that dealt with oral health across ages. So basically with this project, it allowed our students to work together. It was 16 students total, and we had 4 teams of students representing each discipline. And so the colleagues were randomly assigned to each group of the students. So that was randomly assigned as well as the students as well, but we made sure that each student was represented by their discipline. And each student, each group had an oral health topic. So it would be oral health in infants, oral health in toddlers, oral health in preschoolers, and basically each discipline had to provide their perspective as to how they would educate that age group and the parent. What are some environmental factors? What are some nursing related factors, medical factors, et cetera? And so a couple barriers. Time was a barrier. As you can imagine, getting 6 to 8 colleagues together, as well as 16 students, to have these meetings so that we can coordinate our projects was a challenge, but we were able to move through that by creating online, using the technology to communicate weekly. We did that through Blackboard, actually. And so not only did this experience help our students see which the disciplines and what they can bring to oral health and vice versa, but it also allowed for me to connect with colleagues in the college, some of which I've never worked with before this experience. And I was able to learn as well from them regarding what they're telling patients about oral health in their respective disciplines.
Thank you. Before we move on to another question, 2 things I'd like to do. Briefly, I'd like you to respond to Dr. O'Q, you're from the College of Education, and Professor Claiborne, you're a dental hygienist in the School of Dental Hygiene. Previous to engaging in interprofessional education, in your education, when you were being educated to do what you do, did you have an opportunity to learn from, with, and about other students? From other disciplines outside of the general education requirements?
No, it was not as global as it is now. We more so collaborated intra-professionally within the discipline, but not necessarily across disciplines. I don't recall having a lot of experiences where we work with nursing students at a larger scale. Certainly with community health events that we did have some experience working with other professionals, such as the MOM project that we typically participate in, and the Norfolk Homeless Connect. But those were like major events that would happen throughout the course of the career in the dental hygiene. It wasn't consistent as like how we're doing now, like having a course that actually brings all the different disciplines together. That's, of course, fairly new.
So it wasn't in the course?
Right.
Okay, thank you. Dr. O'Q, briefly?
So for counseling, it's unheard of. There's no such thing as interprofessional education in counseling. We don't get together with medical professionals. We don't get together with business or law or anyone for that matter. We're very siloed. in that retrospect. And it's partly because we're a new profession still. If you think about the scope of professions and how professions become professional, we're still new. Our ethics is from 1960. You know, nursing's ethics are from whenever.
Around the same period.
Around the same period. But we're still progressing. We're still trying to get to that idea that we are our own discipline. Because a lot of times we get mixed up with psychology. My grandmother still says, you know, my granddaughter has a PhD in psychology. I'm like, no, I do not. I stop telling people that. You know, we get confused with social work. We get confused with financial counselors because our name says counseling. And so we're still trying to figure out ourselves. And so we are very, very siloed in education. We want to be trained by counselor educators, and, you know, that's what we want to do. And so it's hard to just kind of expand out of that.
Thank you. We have 2 minutes. I want to show the video now for the purpose of showing that it is wonderful words, siloed. And we would tell you, Dr. OQ, that whether it is engineering or business or nursing or English, we have the tradition of educating our students in a siloed, with a siloed approach. So thank you for that. Or their extracurricular activities that we do, health fairs or something else. So we want to also show that we're not siloed here at Old Dominion University, that the context of interprofessional education is broad and national and global.
At the University of Arizona, the Interprofessional Education and Practice Program, more commonly referred to as IPEP, is working with academic and community partners to ensure that our health professions education provides hands-on opportunities for students to learn and practice in collaborative team-based environments to provide quality, safe, and patient-centered care. So exactly what is interprofessional education? According to the World Health Organization, interprofessional education occurs when students from 2 or more professions learn about, from, and with each other to enable effective collaboration and improve health outcomes. The reason for interprofessional education is simple: the patient. It's all about the patient. It's about better, safer, and higher quality patient-centered care. At its core, interprofessional education is really about learning together to improve the health and safety of patients. The concept of interprofessional education is not new, nor is it limited to just a few professions. In June 2002, over 150 leaders and experts in health professions education, regulation, policy, advocacy, quality, and industry attended the Health Professions Education Summit to discuss and develop strategies for restructuring clinical education to be consistent with the principles of the 21st century health system.
So, wanted you to see industry. And that's key because we're talking across disciplines today, talking about collegiality across disciplines, and want to make the point that interprofessional education is not limited to the health sciences. The core may be the patient, but the patient is not a patient. We all have that opportunity, but we live our lives as people. And so there are many things that we need to do as people and in our communities, structural-wise, with engineering and such, in industry, in order to maintain our health. So we don't have our colleagues represented today, but we work with those in computer technology. We work with those in engineering. We've been working with those in business. We just happen to have a core group of folks, primarily 75% today, from a health-related discipline. So with that, you also say that they use the words learning. We keep talking about learning from each other. So I'd like to ask our next 2 panelists, Dr. Hoke and Dr. Poston, to respond to this question. What lessons have you learned by collaborating interprofessionality or engaging in interprofessionality with your colleagues?
I can respond to Okay. I think for me, one of the primary lessons I've learned, and I had a mentor when I was working through my PhD that always said, know what you know and know what you don't know, but know how to figure out what you don't know. And I think to work collaboratively with a group of people that are from different professions or different disciplines or different backgrounds, you need to let yourself be vulnerable and very open to not knowing everything about everything. And you need to be willing to sit down at the table and know that I don't completely understand that profession I'm working with. I'm trying to develop a simulated case or an educational experience, but I can learn so much from that, and there can be a better product at the end if I just say, I do not completely understand what your profession might bring to this experience, or vice versa. And so I think coming from an athletic training background, our profession is also very young. We are evolving as healthcare professionals. We are attempting to move forward and put a stake in where we are in the grand scheme of healthcare and how we can fit into the new model that's evolving. So I find myself a lot of times when working with collaborators is really sharing what we do and where we can fit into the environment or into the educational experience. But also I want to know more about what they do. And I want to know more about what they bring to that experience as well. And then that has also definitely helped me in my teaching. So when talking with students, students know if you don't know something, right? But they expect you to know everything. And so being able to say to them, I do not understand completely what that profession does or what that healthcare provider might be able to bring to you, but I know who we could speak with, or I know where we should go to find that answer. And helping them build a collaborative team of healthcare professionals in their practice, being able to go to a physician and say, I do not know this, I cannot differentially diagnose this, I'm here today, here is my patient, here are their signs and symptoms, and working together has really helped them as well. And I've been able to model that behavior a lot better just through allowing myself to know what I know what I don't know, and begin to learn more and discuss with my colleagues.
Thank you. That's really, you put it in a nutshell. Thank you for that. Dr. Poston?
I'm going to take it from a little bit of a different angle and start with this idea that, and I'm going to say I borrowed this from Dr. Brashear's talk last week as well from the University of Virginia, this concept that a group does not equal a team, and a team of experts does not equal an expert team. And so in my experience as a faculty member engaging in interprofessional education with a research team of faculty members as well as with colleagues outside of that research team, it's been important for me to understand that interprofessional education sometimes is a happy accident when we're at a health fair together or we are in a patient care scenario and we say, I know who to call about XYZ. But when it is intentional and it is strategic and we spend the time with each other as faculty members to work on the faculty development piece around these skills, it's really a much richer product in the end for our students and their experiences. And so this concept of modeling what we teach is so important. And in the feedback that we get from students in my last few years of experience with this, they can tell if the faculty are not 100% bought into this or they're not 100% really raised in this idea and committed to it. And they give us that feedback. We really want to see the faculty doing what you're asking us to do and how important it is for us as faculty members to be modeling what we teach, practicing what we preach. It's a really important concept for me, and it's something that we talk about quite a bit within our research team, as well as in our Standing Committee for Interprofessional Education within the College of Health Sciences. We are very intentional about this. It is not a happy accident in our classrooms. It's something that we're very passionate about and committed to, and that's an important piece of it. But we've also spent the time and energy and committed ourselves to our own faculty development around this content so that we really can demonstrate to students within our faculty interactions what it is we want to see them do when they leave our university and are practicing in hopefully expert teams within the healthcare system. So that's an important piece for me. That's something I've learned along the way. And I'll add this tidbit. We were talking the other day about kind of where this interprofessional education experience began for each of us. And for me, it began in my undergraduate nursing career, and it was an intentional participation in a Breaking Bad News seminar with medical students. And I was one of 2 nursing students in a room of 20 medical students, which can sometimes be intimidating. This was quite some time ago, kind of at the beginning, I guess, of interprofessional education. And so for me, it's been part of my educational experience from the beginning. And so when we started talking about this very intentionally within the College of Health Sciences, I raised my hand and said, this is how we do it, right? This is how it should be done, right?
Absolutely.
And there has been an evolution of thought, I think, within our own faculty in terms of really engaging and embracing this idea. And it's something that our students are really, I think, very excited about. And we get wonderful feedback in the projects that we do with them in our intentional work around interprofessional education.
Dr. Poston chaired the Interprofessional Education Task Force in 2013. And in doing that, she made certain to include some of our colleagues from other colleges, from business, from education, and from others. Now, so we've moved along. It's about 3 years in. We've begun to have a cultural shift. We will be very honest. There has been resistance from faculty in particular, because as faculty, we love to know what we know, and also we've been educated in silos. Because whether it's a new profession or not, this is my territory. This is my knowledge. However, we've learned from science it's got to be collaborative knowledge. So here we are, Interprofessional Education Advisory Committee. We have folks from education, we have business, we have arts and letters. Oh, we're so happy. And we have health disciplines, health professions represented at the table. We have patient representative, someone who's come from academia, but recently has been a patient in a long-term situation, bringing that perspective. Remember, we all are going to have that opportunity. And then we invite someone from an organization, from an institution, a local healthcare institution, and they bring a new mix. However, remember, look at the schematic there. Community is very, very important. So now they bring in different things, health informatics, and a thought about expanding the way we think about these things. So I would like, in our last 10 minutes, to ask you all for two things. We'll start with the first one, and then there's a second. So you don't have to jump to the first question because we have a second one. The first is, in this, going along this path, this journey toward achieving what I call the interprofessional education as the status quo for educating students in the 21st century university. How have you evolved? And how has the connection with colleagues contributed to that?
You know, I think that's a great question, and I oftentimes reflect back on it too, because I started with IPE back in 2012. And so I feel like that's not that long ago, but if you think about it, it's 4 years ago. And that's a long time because some of my colleagues I'm still telling them about IPE in 2016. And so I think in terms of evolution, I feel like I'm growing into it. I'm understanding more about IPE. I'm learning more and more every day what this can look like. Because at first I thought, well, this is great. We'll have my students in the same class with nursing and whoever else, and they'll learn something cool. But now it's moved from that to, okay, so how can we impact patients? I'm thinking about having counselors in cancer treatment centers, in community, agencies, not just community mental health, but just gen care facilities, things like that, neighborhood clinics. How can we integrate counselors into these places? And I thought about it, and I remember thinking about this in 2013, and not having the words to tell places that when I went. If I go to gen care and say, hey, I think we should have counsels here, and they say, why? I'm like, because it's nice, and I want you to do it. But now I actually have the words to tell people, and I think that's the evolution. It goes from this idea to, I think we could do it, to, I'm doing it, this is cool, to, how can I impact patients? What's the next step? What's the next level for counselors? And so I talked back to some of my students who took this interprofessional class back in 2012, and I say, well, how are you using IP? And I had the first student I called and asked her, she said, I'm not using it at all. And I was thinking, what? What do you mean you're not? Why? And she said, well, but my mom has been in the hospital, And I have noticed some things, and I have been able to speak up and say, hey, are you and the doctor communicating? I have been able to, I said, well, you're using it. You know, I didn't say are you using it at your job. They're using it in their lives. That's the benefit of IPE. You don't use it only in the next class that I go to or the next job. You use it forever. I mean, it's always there. And so now I'm thinking about, you know, how can we expand it? I have mental health counseling students who tell me, well, I want to open up my own practice. I said, terrific. What do you know about small businesses? Nothing. What are you learning in class about small business, about how to do budgets, about how to get office space, about how to, you know, well, nothing. And I think, okay, so we need to expand it and work with business now. I'm seeing, you know, activities and things that we can do that we can work with business to help our students develop business plans. Those things are important. You get out there in the world, you have your license, you're a mental health counselor, you want to start your own business, you know nothing about business.
Thank you for that. And from what you said, I think we need to make a distinction for our audience.
Yes.
You said, you know, how are you using IPE? Well, so we have to make the distinction. You have a handout.
Mm-hmm.
So interprofessional education is how we go, the approach of educating students. And we have this, we trip up on this terminology all the time in our own college and when we go out and talk to others. What Dr. O'Q is really highlighting is interprofessional collaborative practice or interprofessional teamwork. So we do that. There's a lot of acronyms, right? So we're engaged in IPE, interprofessional education, with the goal of preparing students for interprofessional collaborative practice. Who else would like to respond to how you've evolved?
I will jump in. That's all right with you guys. I would say I would point a little bit to what's happening in the research literature around interprofessional education and practice. And we've moved from this concept of, yes, it's acceptable, it's feasible, kids like it, students like it, patients like it, providers like it, we like it, we can see the value on the surface. And the research literature is moving towards what is the value for the patient, where can we start to see measurable changes in patient outcomes at the end of the day. And by patient, we're not just talking about the patient in the ICU, we're talking about communities and populations like Dr. Tufts began with at the beginning of this talk, and looking to see where we can measure change in those specific settings. And that is where the research literature is moving, and there's a lot of discussion among researchers in this particular area about how we start to quantify and really tell the story of what's happening after our students leave these educational experiences and are practicing as professionals. Are they taking what we teach them with them? Are they impacting change within their healthcare systems based on the knowledge that they have in our experiences within our classrooms? And what's happening after they leave. That's what I'm most interested in. And I think that's the evolution of my experience as well, is we've moved from this idea of we're all pretty bought into this concept as something that's important. We see the value of it, but moving to the next level, let's start to capture some of the measurable outcome piece and start to be very strategic about the research that we're doing and start capturing a lot of this work along the way so that we have a stronger story to tell in terms of the validity of the work that we're doing. So.
Absolutely. Thank you for that. Our last question before we move to some interaction with our audience. And so briefly, if someone would like to respond to this, from your perspective, what's the value added of engaging in interprofessionality and collegiality, interprofessional collegiality with your colleagues and different associates, whether it's here at Old Dominion University or as we started last week, working across institutions in our Commonwealth. So what's the bottom line? What's the value added to you as an educator and a scholar?
I think I can speak to that, especially from a scholar's perspective. My area of research has never really focused on interprofessional education or interprofessional collaborative practice, but my PhD was built around the concept of interprofessionalism. It was a PhD in rehab sciences, so all my classes had students from multiple different healthcare disciplines, and they were taught by by professors from different disciplines. So it was not, when I left there, that is just what I knew as a norm, but it wasn't necessarily something that we studied per se. But I know here, and in my tenure here at Old Dominion, I've definitely approached the projects that I work on from a very interprofessional lens. and really said, okay, I really want to focus on this health condition or this pathology, but I know there are other experts that can bring a different viewpoint or bring different outcome measures to assess, or broaden the scope of the project and broaden the reach of where those findings can go from beyond athletic training, but to nurses, to the public health arena. And then that's invited me to really develop collaborators that are in different disciplines and reach out into the community as well. So I know for me, I've really gone, and when I look at a project or an area that I'm working on, or a doctoral student that I have mentoring, for example, she has a very focused area of interest that I'm not an expert in childhood asthma. I'm not, but she wants to look at it from an athletic training and nurse collaborative experience, and how we can enhance that communication between those two and to provide effective health care. So I reached out to Dr. Poston, who I know has a background in that area, and I said, would you be interested in working on this project with this student, and bringing that perspective and the knowledge from education from nurses that specialize in that area. And then that led us to working with another colleague within the College of Health Sciences who has studied asthma in the past from a public health perspective, and what that means, and from the children, not only public health, but children's perspective as well. So I've been able to really look at a lot of the areas of my scholarship and say, who else would make this more impactful, and how can I broaden the impact too? Let's just not put it into the Journal of Athletic Training. Let's put it into a journal where I know other individuals from other healthcare professionals that are interested in that information will find that information and be able to apply it to practice.
Excellent. Any final thoughts before we engage the audience? Well, let's turn it over.
So thank you very much. It's really been helpful to learn more about the education process. And I have a lot of things I would say, but I'll limit myself. Mostly because I come from an integrative medicine background, so I've worked in research and clinically with different professionals. But my question for you is, how do you deal with resistance with trying to collaborate? So this week I was teaching in one of my classes about counselors trying to work better with psychiatrists who provide the medication. And sometimes in practice we run into resistance or challenges. So I just wanted to know if you have anything to share about improving the connections between professions.
Are looking at me. I will take a stab at that answer. I don't think I have the answer yet. I don't think the research literature has the answer yet either. But I would say in my experience, in the last few years in the College of Health Sciences, as well as my experience as a provider, I'm a pediatric nurse practitioner in practice for the last 10 years. And I feel like pediatrics in general, we're pretty good at collaborating with each other. But for me, it has been this lesson of stick-to-itiveness. You have to be, you have to kill people with kindness, and you have to show them the value in what you're trying to achieve and the way that you're trying to achieve it. And from a faculty perspective, that typically means you need to come with data and you need to come with evidence that shows that this is going to potentially impact outcomes that mean something to the team that you're working with. So you have to speak in their language and really help them understand what value it is that you bring to the team and what value it is that they bring to the team. And sometimes that means being vulnerable and saying, I know I'm not an expert in XYZ, but I know that you are, because your publications are fantastic, and I know that the research that you do is really phenomenal in moving this science forward, and I really need your help to help me do that as well. And so being able to be okay with that kind of conversation in academia is an important lesson to learn. And sometimes it's not easy, but you have to stick to it.
Stick to it. And Christine, I would say we don't have an answer. And I think you were speaking about in practice, and you've prefaced your question with that you're used to this, integrative health, integrative medicine. Of course, that's what we do, right, in integration, when we talk about wellness versus medicine, right? However, the folks that are in the field that you're meeting the resistance from, or the faculty who are in the university who you're meeting the resistance from, this is new to them. They had a territory, and now who's trying to encroach on that territory? Mm-hmm. However, the science, the data, the evidence does show that the earlier we begin to educate folks who will engage in these practices and be in the community together, the much more likely they will not exhibit that same sort of resistance. And we do have evidence. Many of you are probably familiar with something called "to err is human." It was a thing around the late 1990s, and it was all over our news, on the Today Show, everything you could think about the about 100,000 medical errors that kill people every year in this country, at least a minimum, direct medical errors. Well, the reason that the evidence shows is that folks don't work together. They don't collaborate together. So I know my area, you know your area, and we each come in and address the person from our perspective instead of working together to see what is the best outcome. But we were educated that way, Christine. So we don't have the ultimate answer, but we're propositing today that the answer is to shift the educational norm so we shift the culture ultimately.
That was really great. One of my roles here at ODU is to work with faculty to develop new interdisciplinary offerings for our students. So what do you guys think? What are the training opportunities for our students that could spring out of this IPE, and what majors, what minors, what kinds of certificates, and what kind of faculty development should we be providing? And okay, I'll stop there. But also as a member of the community who has given care to 2 parents in the last 15 years, I almost could cry listening to this as a need, because, I coordinated all that care, and I'm an oceanographer. So it's so interesting.
I guess I'll take this one
Thanks.
to answer some of it, at least. You're certainly correct as far as how do we engage our faculty across the larger campus. And I would say faculty development opportunities such as coming to various seminars and forums to hear other experiences, to engage with each other. I mean, after you leave here today, you may connect with the faculty and have that conversation and network. As my colleagues have said on the panel, we are dealing with a more aging population. Our aging adults are living longer. And like you just indicated, that you had to coordinate care for your parents, and that's not uncommon to do. My father had a health crisis last year, and thankfully, he was in the care of I would say, a good collaborative team. But had I not been involved with IPE or IPC, I would not have known that, or been able to recognize that he's getting everything that he needs, and all the care partners are there at the round table to have that comprehensive patient care plan for him. Anybody else want to say anything?
I could speak. So I just appreciate your questions and just kind of how you're thinking, because I mean, it's exactly what we want. It's exactly what I want to hear, that people are actually interested in this. What kind of certificates? Where do we go next? And I think in terms of certificates, I think offering a certificate that is global enough that people in business, in engineering, in the College of Health Sciences could get this and it could mean something for their profession is important. So just a certificate in interprofessional education in technology, or interprofessional education and research, I think are good areas for people, and I think it could be beneficial to their careers. I've often thought of, I've talked to a friend of mine, he's done now with medical school. He's in his residency, and he talks about just helping skills. Can I help him with, how do I talk to people? How do I tell them that they have cancer? How do I tell people this? And I said, what are you doing now? He's like, well, I'm just going in there and telling them, because I only have a few minutes with each person. What? That's all you do? And he's like, well, I could tell them that they could get resources. And it's like, so I think there's a need too for helping skills. The area that I have the most expertise in offering that to other professionals, even in business too, right? And so I speak to colleagues who are in business and who have their own businesses, and the idea that to facilitate relationships with different people, you need to use some of these helping skills that counselors are trained in. And so I think that offering a general helping skills course for other professionals I think would be a good idea and a good place to start to get people in the same group too. And I think organizing courses around a specific topic, so like geriatrics or medically fragile children or something like that, is a good way to get different professionals in a course too.
I think a way to begin to get student involvement across, so one of your questions, I'm sorry, I'm trying to remember, is just how to integrate some of this into the students and courses and those types of things, is to use the resources that are already available. And I feel like there's a lot of individual presentations or individual discussions or individual activities that are within all the schools and all the colleges and the departments within the colleges across campus. But if there would be a way to streamline that into one system, and maybe freshman students have to pick 4 out of the 27 offerings that year, and there's some system in their academic advising or something that they honor system that they attended those, or they provide some sort of sheet that says they win, or I'm borrowing this model from a place I was before where they had a card and the students had that card for the whole semester. It outlined all the activities from all the different schools that semester, and they had to go and get a signature from someone at one of those in that academic semester, and they turn it in. And that was part of just being involved in the college, in the school, in the university. So I think that's one way to get students going to an event and learning from other individuals, and that's a good step. That's probably just and I'm going to say this, mass organization, but those happenings are already happening, and now you just invite the students to attend from a different perspective to learn more about that profession or that group or those types of things. And I think that's a good step before the development of a course and getting it on the books and bringing all that together is done. It's a good piece to move forward in that direction.
And Liz, you also asked about faculty development. And so we've had these discussions, you and I, and you know that faculty development is a big piece of it, and we do have to address that before we can really go forward in any large-scale way. So a commercial for us is that we have been doing a lot of faculty development, and we do invite faculty from other colleges and such. Coming up April 6th, from 1 to 4:30 is the second annual College of Health Sciences Interprofessional Education Day. And during that time period, we'll have a keynote speaker who will come from the perspective of patient, but from quality and safety as key to a good experience being a patient. We'll talk about the large-scale picture of prevention and intervention regarding motor vehicle accidents here in the Commonwealth of Virginia, because this keynote became a patient as a teenager because of a motor vehicle crash. I've been taught to say they're no longer to be called accidents. So that's there. And then we'll have an opportunity for small group collaborative work with students, faculty, patients, and community as part of that day. And we have opened the invitation to other colleges we invite. So that's the beginning, that's awareness. But we've also been doing some directed faculty development, and we did a whole retreat in January, which was well received by the faculty. That was faculty development, because we do need that key cohort of faculty to move beyond health sciences and across the university so we can all work more effectively together. So if you have any thoughts about how we can engage in faculty development together, we truly invite it. Anyone else in the audience who would like to weigh in?
I have one more thing I want to add to your question there, and it's pretty simple, and you guys can correct me if this already exists. But just the concept of creating an operational definition for coursework that involves interprofessional education that is universal across the university. So if we can come together and agree on an operational definition of what it means to have a course that involves interprofessional work, what are the qualifications at each level of education, and then creating that tagline in the course name that has an IPE somewhere in the PRINs that says you're signing up for a class that has interprofessional education embedded in it, or practices or experiences related to that, so that it's clear to students from the beginning in registration that this is a course that's going to talk about these concepts and engage in this work. And if we as faculty members can come up with an operational definition to make that easy for faculty to say, my course qualifies for this moniker because I have XYZ experiences embedded in it, that's an easy to me sounds easy way to create some sort of consistency across the university in terms of how we talk about this from a strategic educational standpoint, if that makes sense.
Well, and Lisa Mays here on campus, that's part of her charge at this point with the high impact learning practices. Interprofessional education is considered under the context of high impact learning practices. So Lisa Mays has that hat right now, and she's working to move that forward. And so, yes, absolutely. Thank you for bringing that to the table, Dr. Poston. With this, if there aren't any more questions or comments, I think we'll close. Thank you so much.